sodium consumption reduced by over 20%, getting close to the target set in 2013. This government-led, multi-pronged population salt reduction guideline will require the commitment and participation of all stakeholders for successful implementation. It will create a healthier food landscape in Nigeria, empower consumers, promote transparency, and foster collaboration between policymakers and the food industry. Reducing sodium intake is one of the most cost-effective ways to improve health and reduce the burden of NCDs, as it can avert many cardiovascular events and death at a very low program cost. For every $1 invested in scaling of sodium reduction interventions, there will be a return of at least $12. The World Health Organization is promoting efforts to address social determinants of health across life course by making it a priority in its global health agenda. With the launch of this guideline today, we therefore reiterate our call to action with a call on the government to adopt and implement standards for front-of-pack labeling and marketing restrictions to improve surveillance on salt sodium population intake, salt sodium food content, and salt sodium dietary sources. We also call on industry to implement the national sodium targets and benchmarks, reformulate food products to contain less salt. We call on civil society and consumers to advocate and demand for lower sodium in processed foods. We call on the mass media to promote behavioral change, communication, and campaigns to raise awareness on salt consumption reduction, including social marketing, to reduce sodium and promote intake of healthier foods. WHO remains committed to supporting member states to implement, monitor, and enforce policies and other measures to ensure that every adult and child enjoy the right to safe, secure, and nutritious food and the highest attainable standard of health. We pledge our continuous technical support towards the successful implementation of this guideline and monitor progress in doing so by not only updating the sodium country scorecards and periodically publishing global sodium reduction reports, but also refining the algorithm, assumptions, and methods used in these activities as new evidence and guidance to actualize this goal. Thank you all for your attention. Dr. Walter Kazadi Molombo, Country Representative of WHO Nigeria. Thank you.
Thank you very much, sir. Right now, we'd like to recognize the presence of the Special Assistant Technical to the Honorable Kennedy O. You're welcome, sir. Right now, we would like to proceed with our goodwill messages, and following up with the goodwill messages, we would now like to take a message from the Association of Master Bakers and Caterers of Nigeria, AMBCN, in person of Alhaji Mansur Umar, the National President of AMBCN. Please, can we put our hands together? He's making his way up to the podium. You're welcome, sir.
Good morning, everyone. Please let me stand on the execution protocols. On behalf of the Association of Nigerian Master Bakers Association of Nigeria, I am delighted to extend our warmest congratulations to the federal government, to the Federal Ministry of Health and Social Welfare, and all the stakeholders involved in this development of the National Guideline for Sodium Reduction. As bakers, we recognize the critical role that our products play in the daily lives of Nigerians. We also acknowledge the importance of reducing sodium intake in promoting public health and preventing non-communicable diseases. The launch of this guideline is implementation of this guideline are reducing the sodium levels in all our products. We believe that these initiatives will not only improve public health, but also enhance the competitiveness and sustainability. Once again, we congratulate the Federal Ministry of Health and all the stakeholders involved in this initiative, and we also look forward to working together to promote healthier baking practices and improve public health in Nigeria. Thank you.
More goodwill messages still pouring in. Right now, we would like to invite for their goodwill message the Country Director of Nutrition International, Dr. Osita Okonkwo. For his goodwill message, do we have Dr. Osita here with us? All right, Dr. Osita is making his way up for his goodwill message. Please, can you put your hands together? You're welcome, sir.
Good morning, everyone. To stand on existing protocols, the Honorable Minister here represented in this meeting, I stand on behalf of Nutrition International to express our support to this intervention. As you probably know, at Nutrition International, we emphasize on healthy, delicious meal and healthy living. Having appropriate meals or appropriate nutrition that identifies the need to stick to the WHO recommended 5 grams per day of salt is healthy. We promote that, we support that, and we are happy that at this time, at this junction, the government of Nigeria have recognized the need for us to have a guideline that would ensure that all stakeholders stick to this guideline. We will continue to provide our support to the government of Nigeria and ensure that this policy, despite the fact that we are all gathered here to launch it, must be well implemented. Our support is to the government and people of Nigeria. I want to assure you that we will continue to make every available opportunity we'll have to provide the technical support we will need to ensure that the government implement these guidelines. I want to thank all those who have come today to celebrate, and also want to let you know that it shouldn't be a jamboree. It should be something that we'll all take home and make sure that we implement them. A lot of times in Nigeria, we come up with policies, but the issue is how do we implement these policies? At Nutrition International, we stick to ensuring that policies are implemented, and we want to be sure that everyone who's gathered here today is part of this call to ensure that Nigeria maintains a healthy lifestyle for everyone. And that means that we will be able to do what is required in our own domain to support government to implement programs and activities that directly affect our lives. And in this instance, reduction of sodium in our dietary intakes is very vital. It helps to reduce non-communicable diseases that we have all known, and it also has a healthy life for the people. And that's what we will support in Nutrition International. Thank you for allowing us to speak. I want to let you know that we are with you in this journey. God bless you.
Thank you very much, Mr. Osage. Right now, I would like to take more goodwill messages from the Executive Director of Resolve to Save Lives, ably represented by Mrs. Okioma Obasi. Please, can we put our hands together? She's already up to the podium, looking very beautiful and shiny. You're welcome, Ma.
Welcome, everyone, and good morning. Permit me to stand on existing protocols. I bring warm greeting from the Executive Director of Resolve to Save Life, Nanlop Obureke, who is unavoidably absent due to work exigencies. I also wish to extend the regards of the CEO of Resolve to Save Lives, Dr. Tom. Non-communicable diseases, NCDs, indeed remain the leading cause of death globally, account pandemic-related deaths worldwide. In Nigeria, NCDs pose a significant threat, particularly cardiovascular diseases, which have the highest prevalence among NCDs. The effort to reduce excess sodium is indeed a crucial step in mitigating this health risk. Cardiovascular diseases claim lives of at least 19 million annually globally, making them the leading cause of NCDs. Reduction guideline by the Federal Ministry of Health and Social Welfare is indeed highly commendable. Today, as a nation, we join a select group of countries worldwide in marking a significant step towards reducing excess sodium intake, a key risk factor for cardiovascular diseases. Resolve to Save Lives extends its heartfelt commendation to the Federal Ministry of Health and Social Welfare under the leadership of the coordinating minister for her assiduous efforts in developing a national sodium guideline. A special appreciation co-working group on sodium reduction, whose dedication, hard work, and rigor have resulted in itself as a leader in promoting healthy food policies in the African region, demonstrating its commitment to addressing the burden of non-communicable diseases and promoting a healthier population. In conclusion, I would like to reiterate our deepest appreciation to the Federal Technical Working Group on Sodium Reduction for their tireless efforts in developing this groundbreaking guideline. As we mark this significant milestone, we renew our commitment supporting the government tackle the scourge of non-communicable diseases in Nigeria. Together, we can create a healthier and brighter future for all Nigerians. And I also want to appreciate all the elders in the room, the professional leaders of thought who we watched drive this process and enable the right environment through evidence-based efforts to make sure that we have the platform that we ride on. Thank you.
Thank you very much. We'd like to recognize the presence of the representatives of GAIN Stroke Action Nigeria and Helen Keller International here present. We proceed with our goodwill messages. We'd like to take a message now from the Global Health Advocacy in the Eye. On that note, we'd like to welcome Senior Regional Advisor, Africa, Global Health Advocacy Incubator in person of Dr. Adiolu Adebiyi. Please can we put our hands together for him as he makes his way up to the podium. You're very welcome, sir.
Global Health Organization, working with advocates and governments to be able to develop evidence-based healthy food policies aimed at improving nutrition and reducing mortalities and morbidities caused from NCDs. The significance of reducing excessive sodium intake is essential for protecting lives from the scourge of non-communicable diseases, especially cardiovascular disease, which is the known leading cause of death globally. This evidence has been well established and documented, and many speakers have alluded to this morning. We can recall in 2013, Nigeria, alongside other member countries, committed to reducing population sodium intake by 30%. It is amazing and commendable to see that Nigeria did not only commit to it, but have taken the giant strides towards achieving it, which is the result of the sodium reduction guideline being launched today. GHI would like to highly commend the leadership of the Federal Minister of Health and Social Welfare and the resilience of the Food and Drugs Department for successfully developing a robust guideline for sodium reduction that covers various interventions, including setting salt targets in identified food categories. Also highly commendable is the multi-sectoral approach to the development of the guideline, because we acknowledge that it's not just the final product that is of essential, but the process through which we arrive at it. So we want to say a big congratulations to everyone involved in this process. On behalf of GHI, we want to say this is not a small feat at all, and we are extremely honored to have been a part of this process right from the settings and stakeholder engagements, including setting salt targets in identified food categories. Till date, only South Africa have been able to enact a legal framework for salt targets, and Nigeria can very well be the next in line, setting examples we have actually started. While a lot has been achieved, we must also acknowledge that there's still a lot more grounds to cover towards achieving improved nutrition and better in Nigeria. As GHI, we are committed to continue beyond today, supporting the enactment of appropriate regulation on other health interventions, including designing nutrition profile model that suits the Nigerian system and a best practice for front-of-pack labeling to ensure Nigeria understands and able to make informed choices when purchasing food products and other interventions. Once again, we would like to say congratulations to the Federal Minister of Health and Social Welfare and all partners for this laudable achievement. And we say thank you so much for this opportunity, and we wish us a very fruitful event. Thank you.
Following the goodwill messages from GHA, I would like to move straight to invite Dr. Mole, who is the Program Manager for Network for Health Equity and Development, for their goodwill message. Please, can we put our hands together for Dr. Mole, making a way up stage for the goodwill message? Still looking. Let's put our hands together. You're very welcome, Ma.
Good morning, everyone. Dr. Mole is not actually. My name is Toyin. She's not around. Good morning, everyone. Good morning, distinguished guests, partners, and stakeholders. On behalf of Country Director, Network for Health Equity and Development, Dr. Emmanuel Soko, I want to extend our heartfelt congratulations to Federal Ministry of Health on this significant milestone, the launch of national guideline for sodium reduction. Excessive sodium consumption remains a silent driver, placing millions of Nigerians at risk. This guideline is not just a policy document, but a life-saving intervention that will help to shape healthier food environment, reduce disease burden, and improve the overall well-being of all Nigerians. Network for Health Equity and Development is honored to have contributed to development and committed to supporting the implementation of this guideline through evidence-based advocacy, stakeholders engagement. Thank you again I wanted to say congratulations again to Federal Ministry of Health for this great achievement. And together, let's ensure to make Nigerians can have access to good healthier food choices, and of course to improve the future of the country. Thank you so much, and God bless.
More goodwill messages pouring in. We move now to the Corporate Accountability and Public Part Africa, CAPA, we invite the Executive Director, Mr. Kimbode Oluwafemi, for his goodwill message. Please come and put our hands together as he makes his way up the podium. You're welcome, sir.
Good morning, everyone. Standing on the existing protocol on behalf of the Corporate Accountability and Public Participation Africa, CAPA, we want to congratulate the Minister, the Honorable Minister, Federal Minister of Health and Social Welfare, for the launch of the National Guideline on Sodium Reduction in Nigeria. Today marks a major milestone in efforts towards safeguarding public health through the promotion of healthy diets. And we strongly believe that the effective implementation of the National Guideline on Sodium Reduction in Nigeria will help in no small measure in reducing excessive sodium intake among the cases of cardiovascular diseases and non-communicable diseases in Nigeria. We at CAPA remain committed to our partnership with the ministry and its agencies in promoting policies to enhance positive health outcomes through positive food policy. We reiterate our call on the ministry for the effective implementation of these policies, including the regulation on TFAs by the country. And again, this morning, we're congratulating the Coordinating Minister for Health and Social Welfare on the success of this very important guideline on sodium intake in Nigeria. Thank you very much.
Very much, sir. Last but not the least, we would now like to take our goodwill message from Sanofi, and we invite the policy lead Sub-Saharan Africa in person of Mr. Obinna Chukwudobe for his goodwill messages. Please can we jam our hands together as he comes to the podium.
Good morning, ladies and gentlemen. Please permit me to rest on the existing, already established protocols. I stand here representing Sanofi, and in form of a goodwill message, we as Sanofi were proud to celebrate this significant milestone with the Federal Ministry of Health and Social Welfare and all stakeholders dedicated to improving public health. The launch of the National Guideline for Food Handlers Medical Tests and the National Guideline for Sodium Reduction represents an essential step in enhancing food safety and promoting healthier dietary practices across Nigeria. I understand it's a two-faceted guideline we are launching here. And regarding the National Guideline for Food Handlers and Medical Tests, Sanofi, as a global leader in healthcare focused on disease prevention, we understand the essential role that medical screening and vaccination play in reducing food-borne illnesses. By implementing structured health assessments for food handlers, this guideline will help protect consumers, improve industrial standards, and contribute to a healthier nation for our population. So Sanofi remains proud to collaborate with initiatives that promote public health and strengthen food safety systems. We look forward to collaborating with stakeholders to ensure a lasting impact from this policy. So once again, congratulations on this remarkable achievement, and thank you very much.
We now move into the core of today's occasion, and to set the tone for this launch of the National Guideline on Sodium Reduction. Ladies and gentlemen, please, the Special Advisor to the President on Health, Dr. Salma Ibrahim Anas, ably represented by Dr. Suleiman Mohammed Lawal. Please let's put our hands together as he comes to deliver the keynote address.
Good morning, all. Kindly permit me to sit on the existing protocol and accept the Dr. Salma Ibrahim Anas actually wants to be with us this morning, but she's actually away due to official commitment. And I'm actually asked to read a keynote address. Distinguished ladies and gentlemen, it is a great privilege and honor for her to stand here with you to present a keynote address. She is profoundly delighted to be invited to this official launching of the National Guideline for Sodium Reduction in Nigeria, which is a significant initiative aimed at promoting healthier diets and mitigate the burden of non-communicable disease in Nigeria. Unveiling and launching of this guideline is indeed a momentous occasion and a significant milestone in the history of the national health system in Nigeria. She would like to begin by commending the Federal Ministry of Health and Social Welfare in collaboration with the National Technical Work Group on Sodium Reduction and other stakeholders who has worked diligently to develop these diverse strategies aimed at reducing salt intake in Nigeria for their dedication, resilience, and operational guideline. She wants to use this occasion to express our profound appreciation and gratitude to His Excellency, President Bola Ahmed Tinubu, CFR, for placing health and social well-being of Nigeria as a key part of his administration Renew Hope agenda. Apart from the federal government's budgetary allocation and release to health and social sector this year, he has actually demonstrated government commitment and political will to address the financial gaps that limits Nigeria from achieving an efficient, equitable, and quality health system. Mr. President, your explication that good health is core to harnessing Nigerians' greatest asset, which is its human capital, is at the heart of our relentless efforts to ensure that all Nigerians are on the path to have access to improved quality health service without any form of financial constraint. Although the healthcare sector in Nigeria faces numerous challenges that hinder its ability to provide quality care to its citizens, from inadequate infrastructure to limited access to essential medical services. Amidst the promise of medical advancements, the healthcare sector in Nigeria finds itself entangled in a web of challenges, from soaring costs and strained wallets to unequal access that test the bounds of equity. As we peer into the heart of this intricate system, a complex tapestry of issues unravels, demanding our attention and innovation, producing and unveiling these guideline estimates indicate that globally, we consume an average of up to 10.8 grams of salt per day, far above the World Health Organization's daily requirement diet. The use of salt as inexpensive flavor and the increased consumption of processed foods contribute to this high salt intake. Highest directed sodium intake is a significant public health concern worldwide. It contributes to the global burden of non-communicable diseases such as hypertension, cardiovascular disease, and stroke, which currently affects more than 50,000 Nigerians. Excessive dietary sodium intake is a major risk factor for hypertension and its related complications, end-stage renal disease, and stroke. Epidemiological studies have demonstrated that communities that consume large amounts of salt have hypertension. That high sodium intake is a significant factor in cardiovascular disease and other chronic conditions. Globally, high sodium diet significantly impacts health, increasing the risk of cardiovascular disease, gastric cancers, kidney disease, and obesity. It contributes to millions of deaths annually. Globally, an estimated 1% attributed to excessive dietary intake in 2019 in prevalent based on national estimates and modeling studies. And as of 2024, 27.5 million Nigerians were found to have hypertension, which prevalence ranges from 22 to 44%, depends on the region. This increases the risk of strokes and other complications, and have actually contributed to their death. NCDs threaten the global economy and economic development in response, and the World Health supports 9 targets for prevention and control of non-communicable disease, including a key recommendation to reduce dietary intake by 30% as at 2025. Reducing dietary sodium is one of the most impactful and cost-effective mechanisms to improve population health, and it's actually a best buy for prevention. A modest reduction of salt intake by 15% is actually estimated to prevent 8.5 million deaths over 10 years in 23 developing countries, where 80% of chronic disease deaths is actually due to this non-communicable disease. Nigeria has taken steps to address this issue for more than 4 decades, including National Multisectorial Action Plan for Prevention and Control of NCDs, which incorporates evidence-based policies aligned with the WHO surveillance harness, adopt knowledge environment, that is SHAKE technical package for salt reduction technical package. The National Sodium Reduction Program in Nigeria includes setting limits on sodium contents in packaged foods, mass media campaign to educate the public on healthy eating, and regulation of food and beverages, particularly when directed at children and adolescents. In acknowledgement of this adverse effect of excessive sodium consumption on the Nigerian populace, and noting that in low-income countries, programs to reduce dietary sodium were estimated to have provided significant returns on investment. At the moment, in its journey towards public health, we are launching the National Dietary Action Plan on Communicable Disease. Understanding the sources of dietary sodium is crucial for developing effective intervention to reduce sodium intake and mitigate its associated health risks. Effective implementation of this guideline will go along. The overarching goal of the NCD National Multi-Sectoral Action Plan is to reduce salt intake to less than 5 grams. That is 1 teaspoon per day. And to consume 3 to 5 portions of variety of fruits and vegetables per day, that's 400 grams. Strategies to effectively reduce dietary intake by 30% over the next 5 years through the implementation of this WHO's SHAKE technical package have meticulously compiled into this national guideline, which will serve as an essential resource in advancing the collective objective of fostering a healthier nation. If effectively implemented, through effective stakeholder collaboration, this guideline will help to set sodium benchmark for food categories to drive the reformulation of processed foods and healthier options. On this note, kindly permit me to employ us to ensure effective citizen engagement and awareness creation activities, cooking, to use salt-free citizen on spices, and choose products with lowest sodium content or those with no added salt. Although sodium intake is modifiable risk factor, some studies have actually indicated that high dietary sodium consumption may have a substantially larger life cost impact on blood pressure that is actually currently unidentified. As such, we should collectively recognize the National Sodium Reduction Guideline as a groundbreaking initiative to reduce sodium intake in Nigeria. It is a strategic document that is crucial as a governance instrument to aid legislations, policies, and regulations to define essential elements that, when put into place and successfully implemented, will facilitate the efficient implementation of government strategies aimed at improving health and other quality of life for Nigerians. Distinguished ladies and gentlemen, this guideline is a framework to mitigate the above outlined health risks and promote a healthier population in alignment with President Bola Ahmed Tinubu's Renewed Hope agenda. It is very important to broadcast this guideline through citizens' engagement and ensure consumer awareness to empower Nigerians to make informed decisions. They should note an always important role in cardiovascular health. Modest reduction in sodium intake have been shown to decrease blood pressure instead of cardiovascular disease and related deaths, further emphasizing the significance of reducing sodium in diets. Additionally, reduction in population salt intake not only offers significant health benefits, but also highly cost-effective. There is crucial need for us to collaborate to create an enabling environment through policies, resources, and incentives to ensure that Nigerians understand this high consumption of processed foods and adoption of Western lifestyles. Additionally, taking into consideration the above intents, you will agree with me that there is no dearth of policies in Nigeria, not only in the health sector, but also in other sectors. Instead, it is the suboptimal implementation of the relevant policies and other governance instruments which in turn result in the slow progress in attaining these objectives. On this note, as a distinguished sodium reduction champion and health promotion ambassador, I want to assure you that this administration is committed to further reposition and transform the health sector to be able to deliver quality, efficient, effective, and cost-effective health services to all Nigerians, especially the most vulnerable for Nigerians. For the giant of Africa, with so many novel initiatives at our disposal, we are and shall remain a model of public health excellence, driven by collective effort and determination. The administration of President Bola Ahmed Tinubu is committed and ever ready to collaborate and partner with you and other stakeholders. Let me conclude Nigerians, irrespective of their social class. By the special grace of the Almighty God, we shall succeed. God bless the Federal Republic of Nigeria. I thank you for your kind attention. Best wishes and remain most blessed. Thank you.
Thank you very much to Dr. Sulaiman Mohammed Lawal for the keynote address. We'd like to recognize the presence of President, Association of Public Health Physicians, in person of Dr. Terfa here present. We would also like to recognize the President of the Nutrition Society of Nigeria, in person of Professor Salisu Abubakar, here present with us. We now move on to the overview for the National Guideline for Sodium Reduction. We would like to invite to the podium the Director, National Coordinator, Food Safety and Quality Program from the Federal Ministry of Health and Social Welfare, Mr. Atonda O. John. Please let's put our hands together as he comes to give us the overview of the National Guideline for Sodium Reduction. You're welcome, sir.
Good morning, everyone. The Honorable Minister of Health for State, Honorable Minister of State for Health, ably represented by the pharmacist Olubunmi Arabiana, the Director of Food and Drug Service Department, for me to align with the existing protocol. I don't want to stand on it, and I want to sit, but I want to align with it. Thank you, so that you will not collapse. Thank you very much. Okay, I will make it snappy so that we'll be able to have enough time to ask questions and other things. So, the Secretariat, the overview of the document we are launching today, just want to give us a peep into the contents. So briefly, we will talk about it. This is the outline, why sodium reduction matters. The goals for the sodium reduction, what does the guideline cover head to, and then the clarion call for everyone to join the movement. Why sodium reduction? Excess sodium consumption poses significant healthcare challenges globally and nationally. As every one of us, all the good messages have been emphasizing, and then we are aware why, the issue of high sodium content in our food is a leading contributor to hypertension, which have been identified as a major risk factor for heart disease, stroke, and other cardiovascular conditions. This health issue not only affects individuals, but also place substantial burden on one, the healthcare system, considering the finances and then the details to treat some of these diseases, and also on the society to reduce workforce productivity due to illness, absenteeism. This document was developed in line with the international best practices. You have to follow the procedure using the WHO standard and then the guidelines. So the initial assessment, we had to undergo the initial assessment. They conducted the scoping study used for the landscape analysis of sodium reduction in the country or consumption in the country. And then we have at our University of Abuja sodium study, a group to have all the necessary documents required, the information and the data required. So after that one, the Minister of Health inaugurated a national technical working group on sodium reduction, comprising of all the experts in that area, WHO, from the industry, the academia. And then under that one, we have some subcommittees about this under the technical working group that did under advocacy, the target setting, benchmark, and all those other activities. Then after that one, we worked into drafting the guidelines. The guideline was a series of review, and it was eventually validated. And then after the validation, the Honorable Minister of Health and Social Welfare, Professor Ali Pate, approved the documents, which has culminated into what we are doing here today. So, and then goals for the sodium reduction. As we have been saying, I think most of these things we are familiar with it. We know that we intend to achieve these goals by reducing sodium intake to less than 2 grams per day by 2030. You know, that is the standard. I mean, even we expected to have been achieved by 2025, but because, you know, but at least we still thank God that at least Nigeria is in the forefront of even achieving this in Africa. So we want to reduce the NCD prevalence. That's non-communicable disease. The situation is becoming unbearable. And so we have to do, our target is this have to be reduced. Then we have to promote healthier food options. We have to reformulate the processed foods to reduce sodium level without compromising the safety and the quality of the food. And then also there's need for us to increase the public awareness, because it's not only the industry issue. Even the public awareness have to go to the grassroots. The issue of, it's not only in consuming the processed food that you have the opportunity of, or the chances of increasing the sodium consumption, but even our cooking at home, even on even where we are today, I will watch, because since they started with this program, any hotel, we always tell them that they should not give people excess salt. So that is the part of the awareness that we have to create. And then we have to develop and strengthen regulations for marketing, advertisement, and labeling. That's the work NAFDAC have to do, and then the SON. These are our regulatory bodies. Then they have to put things in place to ensure that one. Then we need to build the capacity of food safety regulators, inspectors, and traditional at subnational level. This document is not for the federal, at the federal level. It goes down to the subnational, that the state and the local government level. So that then we have put some structures on ground to ensure that this is achieved, so that the purpose and for which document was developed will be achieved. What does the guideline cover? The key things, you know, we have about just four major chapters before we have all the analysis. The strategies for advocacy, education, and awareness creation. We have a comprehensive strategies developed in the document, so that even we have a special special committees to work on this one. So when we launch the document, we're just starting another set of exercise. National sodium level targets to 35 food categories. This was done in line based on using the national data. And then it was subjected to international assessment. They are from experts, even from WHO, from abroad, even local, and then the overseas. So we have the surveillance, monitoring, and evaluation measures put in place to assess, to evaluate how the implementation of the document is faring, and then whether it's achieving the purpose for which it was developed. And then explicit roles and responsibilities were shared of the stakeholders who were enumerated, were listed in the list. So when you unveil the document, every one of us, the government, the industry, the regulators, the NGOs, the partners, have their roles spelled out there, make sure that these roles are strictly implemented. Then, looking forward, the adoption and implementation of this guideline is expected to yield significant advantage to public health and society. These are some of the outcomes we're expecting. Enhanced population, projected 25% reduction in the incidence of hypertension. That's our goal. We count on every one of us to support us to be able to achieve this. And then it will give us economic benefits through increased productivity that will typically be lost due to illness, absenteeism, and early mortality. Beneficial effect on the food industry, leading to development of innovative and healthier products with lower sodium content. I want to encourage all our industry, the manufacturers that are here, please to key into this and play your part. We are going to give the enabling environment to ensure that this is achieved. So have your mind at rest. Long-term behavioral change that encourages individual intake, when is their eating practices. So we want, by the time the document is launched, we want to be, there are some other factors that will be put in place so that at least we will be able to, the product, the front of back labeling is one of those things. The regulations on the advertisement and other things will come in, so that we'll be able to see, people will be able to have access, the opportunity of making a choice of what, if you want to continue to use sodium, heat one that's high in sodium, but that there should be alternative, and then there's an opportunity for you to make choice. But our desire is that you change your behavior towards consumption of excess sodium. So we encourage every one of us to join this movement. How can you support the guideline? For the government, at every level, whether at the federal, state, and at the sub-national, you have to implement the regulatory framework, enforce industry compliance, and support the public health campaign at all levels. For the industry leaders, you have to reformulate your products to lower sodium content. That's indirectly that you have to comply with the benchmark and then the sodium targets that have been there, stated in the document. Then for healthcare professionals, we need to educate our patients on sodium reduction, on dietary choices, and also for the general public, we adopt the recommendations on daily life, spread awareness, so this is the overview of the document. And as we leave here today, I want everyone to have the mind that it is our responsibility to ensure this document is fully implemented to achieve the desired impact on the citizens in Nigeria. Thank you very much, and God bless you.
Thank you very much to Mr. Atonda John. In driving forward the 4-point agenda of the Federal Ministry of Health on health outcomes, which includes disease prevention and control, we recognize the critical role of leadership and government commitment. It is therefore with great honor that I invite a visionary leader who has demonstrated unwavering dedication to health. Ladies and gentlemen, please join me in welcoming the Honorable Minister of State for Health and Social Welfare, Dr. Isiaq Adekunle Salako, represented by pharmacist Mrs. Olubumi Aribiana, Director of Food and Drug Services. Please, can we keep her as she makes her way up for the ministerial address. You're welcome, ma.
I wouldn't want to jump on existing protocol. So, the protocol will be well spelled out this afternoon. The Special Advisor to the President, Dr. Sam, the Permanent Secretary, Federal Ministry of Health, ably represented by the Director, Traditional and Complementary Medicines, Pharmacist Tile Titus, Ministries, the Special Advisor to the Minister of State for Health, representatives of the ministries present here, registrars of regulatory agencies, development partners, the University of Abuja, ably represented by Professor Oji, who stood through the development of this project, the industry players, the members of the Technical Working Group on Sodium Reduction, the members of the press, ably represented by the press of the Ministry of Health. Ladies and gentlemen, I bring you first and foremost the unreserved apologies of my principals, starting with the Coordinating Minister of Health, who is unavoidably absent. He knew he wasn't going to be able to come and directed the Honorable Minister of State for Health to represent the ministry. However, the minister was so committed to this project, but just 24 hours to this project, he got a call from the presidency requesting that he accompanies the First Lady to Asaba. and so he had no choice but to ask me to represent him. However, the permanent secretary too was to be present, but because she had another engagement outside the country, also asked me to represent. But I cannot wear two caps in one occasion, so I will wear the biggest cap, the rest assured. And that is the cap of the Honorable Minister of State for Health. And so I bring you his speech. Today is a defining moment in our nation's commitment to protect and enhance the health of every Nigerian. It is with great pride and solemn responsibility that we launch the National Guideline for Sodium Reduction framework that symbolizes our collective determination to prevent the adverse health consequences of excessive sodium intake. As part of the global community, our country has witnessed the transformative power of urbanization, with our diets increasingly incorporating processed and packaged food. These changes have created new challenges to our healthcare landscape and necessitates bold public health initiatives to safeguard our communities against silent threats, one of which is the elevated risk of consumption. Allow me to lay before you some compelling insights. Research has shown that the average salt intake in Nigeria far exceeds the World Health Organization's recommendation limit of 5 grams per day, with many communities consuming between 7 and 9 grams daily. This excessive overconsumption of sodium is directly tied to the alarming rise in hypertension, now of adults in our population. The situation is exacerbated in urban areas where dining habits lean heavily towards salvier prepared meals, unconsciously risking our lives with dietary habits that could lead to devastating long-term health consequences. Figures are not mere statistics, they are a clarion call for accelerated efforts, rigorous monitoring, and creative strategies. Our guideline serves as a blueprint for action and a beacon of hope amid these challenges. The document before us is the first of its kind on the continent of Africa, a living manifesto to change one that harmonizes global recommendation with the local context, detailing a series of ambitious yet practical measures, such as 1, minimum sodium targets. We have established clear limits for sodium content in processed and packaged food, guided by scientific evidence and aligned with global best practices with the support of the World Health Organization. 2, multifaceted public education and behavior change campaigns. Our comprehensive strategy also harnesses the power of mass media, social media, and community outreach to elevate awareness about the health risks of excess sodium consumption and promote informed diet. Our monitoring mechanism, emphasizing data-driven action, the guideline supports continuous national surveillance and evaluation, ensuring that our efforts remain adaptable and impactful in reducing sodium levels. This guideline is a product of rigorous research conducted by the Nigerian Sodium Study Team based at the University of Abuja, in tandem with the dedicated work of the National Technical Working Group on Sodium Reduction and our partners. Their contribution, alongside insights from both the public and private sectors, have enriched this guideline, making it a robust instrument of public policy. Ladies and gentlemen, as we embark upon this journey, let us remember that the health of the nation is a shared responsibility. The ministry has initiated our role in implementation by directing NAFDAC to formulate a suitable regulation that ensures the enforcement of sodium targets in processed and packaged foods, and that is our legal framework. I therefore extend a special invitation to our industry partners to embrace reformulation using sodium in our food supply. Understand that this initiative is not a regulatory imposition designed to disrupt commerce. Rather, it is an invitation to be a pioneer in a new consumer products. The government stands beside you, ready to offer technical guidance and collaborative support, ensuring that your businesses continue to strive while contributing meaningfully to national health. For public health advocates, educators, and the community leaders, there are ample opportunities to make a direct impact. You can support this national effort through community outreach, educating families and individuals in your communities about the benefit of reduced sodium intake and encouraging healthier cooking practices. To academia, we need more collaboration on research and data collection to enhance our understanding of sodium consumption patterns and the effectiveness of ongoing interventions. We all need to participate in public discourse and feedback through public forum and consultations, ensuring that our policies remain aligned with the evolving needs of Nigerians. The commitment we make today to reduce sodium consumption is an investment in the longevity, vitality, and prosperity of our people. It also marks another significant milestone as we not only launch the sodium reduction guideline, but also unveil the national guideline for food handlers' medical tests. This guideline is a critical step in ensuring the health and safety of food supply chain by unifying and ensuring regular medical examinations are conducted for food handlers. Together, these guidelines form a cohesive framework that directly supports the implementation of the National Policy on Food Safety and Quality and its Implementation Plan 2023. By addressing both individual health awareness and systemic food safety standards, we are fostering a unified approach to achieving safer, healthier, and more reliable food practices across the nation. I stand before you with a resolute message to let our actions show our determination and our policies reflect our vision for a healthier Nigeria. I thank you for your unwavering commitment and for joining us on this transformative journey towards a healthier, more resilient Nigeria. May we together dismantle the barriers to better health and set a precedent for the nation on the continent and worldwide. At this point, I am honored to unveil the Sodium Reduction Campaign tagline, "Let your health guide your taste." Health, guide your taste. This simple yet impactful phrase emphasizes the importance of making health-conscious decisions regarding food and lifestyle choices. It serves as a reminder that our health should be behind what we consume. On this note, I have delivered the message of my Honorable Minister for Honorable Minister of State for Health, Dr. Isiaq Adekunle Salako. Thank you very much. But before I leave this podium, I want us to please help congratulate my friend, the initiator, the person who made me have the opportunity to stand today to give this welcome address. She is no other person. She walked into my office 2 years ago, and together we agreed on this project. She's no other one than Dr. Mariam Al-Mansur. Please stand up for a standing ovation. Indeed, the country is very grateful. It is a laudable initiative, and I want to inform us that the ministry is highly committed to this project. And I beg the industry, we are for you, we'll work with you, but we need to be as healthy as possible to be able to deliver on the mandates you have requested of us as citizens of Nigeria.
Powerful words there from the ministry. Let your health guide your taste. Can we let your health guide your taste? That just basically says we need to go easy on our seasoning, on our salt, so that we may be able to live long and achieve our goals. We move now to the official launching of the National Guideline for Sodium Reduction and the National Guideline for Food Handlers Medical Test. This is going to be directed, of course, by pharmacist Mrs. Olubumi Arabiana, the Director for Food and Drug Services, and of course she will be inviting those that will be joining her for the official launching and unveiling of the National Guideline for Sodium Reduction.
So, is everybody's document? So as many as can join me.
At this point,
as many as can join me, please. So, PAMSEC, on the other end, so that we unveil.
We have the PAMSEC for Federal Ministry of Health and Social Welfare, Director of Food and Drug Services, as many people that can join in WHO, Resolve to Save Lives, as many as can join in for this official launching of the Guideline of Sodium Reduction for the health of the Nigerian populace, to see that we increase the life expectancy of Nigerians. A momentous occasion here today. In fact, this is really commendable for the health and well-being, social welfare of all Nigerians. And as you can see, there are many participators, many partakers, many contributors, partners responsible for this milestone.
Okay, so to the glory of God and the benefit of all mankind, we unveil this document. So everyone,
please, before we go, we need to take pictures. Please, before we go, we'll invite photographers to ensure you get pictures. Please, can we conduct it so that we can get pictures?
Same thing. Unveil these documents so you carry all of them.
Everyone will, in fact, get a copy of the guideline.
Okay, please, can we take this photograph in batches? So while we have the first 10 here, so that everybody will be covered. So please, just the first 10, and then another set will come in. Yes, do you have a process? Okay, thank you. Okay, so
for those who don't have a copy of the guideline, there is a barcode on the screen. If you simply use your smartphones or devices, you can scan the barcode and you have access to a digital download of the National Guideline for Sodium Reduction. So we implore that everyone here kindly make use of the barcode visible on the screen. Use your smartphones. And at this point, we would like to invite everyone to climb up on the stage for pictures. Can you please come up on stage? Please, can we climb up on stage for pictures? We don't want too many people on the stage. Yeah, I'm a bit worried. All right, I think that's about the many we can take.
Let me sit beside you. I turned it upside down. You did a good job. Nice.
We now invite everyone to please proceed for coffee. Tea and coffee are officially served. Outside, have some coffee and refresh yourselves. Before we return, the coffee break would last exactly 30 minutes. Please let's keep in mind that our coffee break is only for 30 minutes, after which we will commence a documentary on sodium reduction initiative. So while we sip our coffee, let's be reminded that we will be returning back to the hall at exactly 12:30 for a documentary on sodium reduction initiative. Distinguished guests, ladies and gentlemen, coffee is now served. Let's make use of the time so that we can keep time conscious. We still have a documentary immediately after coffee break. The coffee break will last exactly 30 minutes. So please let's proceed for coffee, and we'll return back to the hall to listen to the documentary on the sodium reduction initiative. Thank you very much.
I didn't know anything about the relationship between salt and blood pressure and hypertension at all. But I remember there was one doctor from our place. Blood pressure and hypertension at all. But I remember there was without salt.
que hasta yo mismo. Un poco tóxico, es que esta mierda competencia y solo con... O por lo menos si me llegan a los tobillos, o cuentas de depósito, o platos que me he comido. Te soy directo al punto domino, ser real va más allá que blanco, negro, así flow periódico, colores sólidos, mano amigo y más negocio numérico, y yo lo quiero todo, llamen un médico, que hasta que llegue yo no voy a tomar ni un respiro. Sé que un día a mí me tocará partir, pero en verdad no toca ahora. Que siga mirando hacia arriba porque no voy a bajarle estando en la ola. No voy a bajarle que ellos aprieten en la zona. Cuando subí fue tapó el monte sin ascensor. Ahora dime quién me entiende, quién me elabora. Muchos no aguantaron presión y se fue quien me pare. Si ya empecé soy el tsunami. No voy a bajarle hasta que esté tirando cambios dentro del Pagani. Mil veces me he caído, one too many. Yo quiero el money, quiero el Grammy, lo quiero tocar mí. Toda esta noche que vivo se me hagan funny. Brincando a Tom por antes era el figure de Tommy. Ahora son BB es lo que antes era Silconi. Ahora como el Connie. Ahora sí que hay torque, no porque ando en Porsche. Nunca me conforme y creo que nunca me conforme. Quiero mi cara en Forbes, mocha el pasaporte. Taleta marica en spray, ya no busco hombres. Ahora sí que hay torque, no porque ando en Porsche. Nunca me conforme y creo que nunca me conforme. Quiero mi cara en Forbes, mocha el pasaporte. Taleta marica en spray, ya no busco hombres. Oye, no cachan código. Lo estoy viendo fuerza conmigo, cabrón, que hasta yo mismo. Sí, un poco tóxico, es que esta mierda competencia y solo compito con yo mismo. Un día a mí me tocará partir, pero en verdad no toca ahora. Que siga mirando hacia arriba porque no voy a bajarle estando en la ola. No voy a bajarle que ellos aprieten en la zona. Cuando subí fue tapó el mon sin ascensor. Ahora dime quién me entiende, quién me elabora. Muchos no aguantaron presión y se fueron como la ola. Yeah, Ramen, Legend Forever, Legend Forever. Reyes bendecidos.
No está pa' juego. Quiere perreo. Quiere perreo. La liga. Mata la liga. No quiere jevo. No quiere jevo. No está pa' juego. Ella no se deja. Quiere perreo. No te deja. Mata la liga. ¿Cómo dice? No quiere jevo.
Distinguished guests, ladies and gentlemen, we will be extending our coffee break for just 5 more minutes, by which time we will now go ahead to take a 6-minute documentary. So let's endeavor to wrap up our coffee and proceed back into the hall so that we can continue with today's order of events. Thank you.
Como pilón, rica mamacita, sexy movimiento, mucho gimnasio, batido y suplemento, rica mamacita, sexy movimiento, explosiva como pesicomento, ella también está puesta para el dinero, antes de casarse quiere viajar el mundo entero, tiene un tercer ojo para leer a los pequeños, no está para ver super solo, no quiere jevo, Mr. Khan, no está para ver.
que dicen que eso pasa, que es normal, que con el tiempo va a cambiar, pero no es pa' tanto. ¿Qué nos pasó? Dime padre cuando acá tú te vas antes de hacerlo. Se te olvidó que fuiste tú que hiciste la primera movida. ¿Qué nos pasó? Se te olvidó que no se te va a olvidar como yo te comía. Cuando llego a esconder el cel, la persa empieza a crecer, pensando que hay un aquel. Vi las llaves de un hotel, tu listilla en un papel y yo jugando tu papel. Yo empecé este juego y no me sé ni defender. Cuenta cuánto tiempo tuve que perder, esto no se va a poder. ¿Cómo va a ser? Ya no me dices pa' dónde va. Y yo no pregunto, solo pregunto. ¿Qué nos pasó? Dime padre cuando acá tú te vas antes de hacerlo. Se te olvidó que fuiste tú que hiciste la primera mujer. ¿Qué nos pasó? Cuando acá no me dejas quitarte lo que tienes puesto. Se te olvidó que no se te va a olvidar como yo te comía. Estas no son horas para seguir hablando. Estas no son noches para yo estar dudando. Esta no es la ropa para dejarme puesta. Dime si estás puesto, dame respuesta. Estas no son horas para seguir hablando. Estas no son noches para yo estar dudando. Esta no es la ropa para dejarme puesta. Dime si estás puesto, cuánto te cuesta. Te lo juro que ya no se siente igual. Ya no chingamos igual. Dime lo que está pasando. Sé que dicen que eso pasa, que es normal, que con el tiempo va a cambiar, pero no es pa' tanto. Tú te vas antes de hacerlo. Se te olvidó que fuiste tú que hiciste la primera movida. ¿Qué nos pasó? Cuando acá no me dejas quitarte lo que tienes puesto. Se te olvidó que no se te va a olvidar como yo te comía. Te vas, me pongo a llorar y no aguanto más. Baby, no te vayas. Solo pensar que tú te vas, me pongo a llorar. Baby, no te vayas. Te necesito. Sin ti me muero.
Distinguished guests, ladies and gentlemen, we now invite you to take your seats as we proceed with a documentary on sodium reduction initiative. Before we do, we'd like to recognize the presence of Professor Abdul D.A. Buba, the SSA Research Affairs representing the Vice Chancellor, University of Abuja. If you're still outside, in the next 2 minutes, we'll be playing a documentary on sodium reduction initiative. Let's find out how all this came to be and resulted to a guideline for sodium reduction. We invite everyone to please settle down now so that we can continue with the program as our time is fast spent. We'll be taking our documentary in just a few moments. I do believe the documentary is ready to be... All right, I have the thumbs up for the documentary. We'll just give our people 1-2 more minutes to come into the hall and we'll proceed with the documentary. Yes, welcome back to the launch of the National Guideline on Sodium Reduction. We now proceed to take a documentary on the Sodium Reduction Initiative, how this guideline came to be, the initiators. I'm going to hand over now to the technical team who will commence to play the documentary. This is about 6 to 7 minutes long. Let's pay keen attention. Thank you very much.
About the relationship between salt and blood pressure and hypertension at all. But I remember there was one doctor from our place, American trained doctor, in the 70s. He will come back, he will, at the church, he will, the priest will give him the podium, he will address my people that they should reduce salt intake. That was my first awareness about that. But as a young man, how can I eat food without salt?
We found out that Nigerians consume sodium above the average of what is recommended by the World Health Organization. The World Health of sodium for an individual per day. But what we found out on the average that we consume about 3.9 grams of sodium per day.
I've been symptomatic of hypertension for the past a few months, will be 40 years. Throughout my undergraduate days, 48, it was all horrible. I was visiting the University Medical Center almost every 2 days. This continued from 75. I graduated 80. I continued 85, 90. I was also still on the drug. They said I should take it every day. I now ask myself that person. I was asking myself, why should I be on drug?
Before I go to the findings, maybe I should just give you a brief on the study. So the study is called Nigerian Sodium Study. And what we set out to do is to look at the sodium landscape, both in our food, what we call packaged and unpackaged food, and also in the population. There are 3 aspects of the study. One of them is to engage different stakeholders, both in the health sector, in policy, in the community, in 3 states of the Federation, the FCT, Ogun State, and Kano. The second aspect is doing what we call a retail survey, and the third aspect is to get to the population, whereby we assess through what we call direct recalls, and also 24-hour urinary estimation, asking these people some questions, and thereby we estimate the sodium intake in the population. So in short, we are estimating knowledge about sodium in the country. Secondly, sodium in our food, both packaged and unpackaged.
We found out that we're having a very high increase in non-communicable diseases, which includes hypertension, heart failure, stroke, and even cases of stomach cancer associated with high sodium intake. And so, looking at the populace and the health of Nigerians, we decided that we need to urgently address the issue. And in addressing the issue, that was what necessitated the food policy as well as the National Sodium Reduction Guideline.
The Sodium Reduction Guideline is a very critical document developed by cardiovascular diseases in the country. And there are so many stakeholders that are involved. So everybody at the different stage have their different roles to play in the implementation of the guideline.
If you look at the sodium policy that was going to be done, that is one of the things going to be looking into. And that's where the academia comes in also, in sensitizing the population, starting first of all with the healthcare workers, because healthcare workers have a lot of inroads to the population. Then can also with other agencies, the Federal Ministry of Health, the media agencies, for National Agency for Food, Drug and Administration Control, for example, the News Agency of Nigeria. We can also partner with them to sensitize the population. So what are we trying to do? As a second phase of our study is to use our data, translate them simply to educate the population.
In the document, we have a benchmark set for the level of sodium in different categories of food that they manufacture. Like in the noodles, there's a specific benchmark that is set for sodium, level of sodium that's being in the noodles. In bouillon, there are certain category, level of sodium that has been set, the benchmark.
The one message I have for Nigerians is that in as much as we love to have that improved taste in the meals we eat, we should also realize that the more salt we take, the more problems we create for ourselves, and the need for everyone to be salt conscious and reduce the salt we take in our food. And for those who are very, very particular about processed food, the policy has stated clearly that all manufacturers should state the quantity of salt in each processed food that is in the market. So based on that, I'm calling on all Nigerians that whatever processed food they want to buy, they should ensure that they read the label accordingly and know the quantity of salt in it before procuring those processed food. And based on that, since they are aware that high salt intake is not good for them, they should have little on.
When you are conscious of what they're eating, it will improve your taste. A slogan for this sodium reduction: let your guide take.
Quite an enlightening documentary there. Read the labels when you're purchasing your items in terms of processed foods, and let us be conscious of our salt intake. We're going to move now to a panel discussion, a very key panel discussion where they're going to be talking about reducing sodium intake for a healthier nation and implementing national guidelines and strategies. To moderate this session and invite the panelists for this session, join me in making welcome Mr. Femi Stephen, who will be the moderator of this panel. Please let's put our hands together as he comes to take over the panel. I'll be handing over to you for some time.
Thank you so much. If you want to clap for me, you can clap for me. We've gone a long way in the last 1-2 years to ensure that this document has come to life. So I'll join my directors and the minister to thank all of you for your support one way or the other in ensuring that this day comes to pass. I also thank those our partners that were a bit skeptical, but we've won, please. So without wasting much of our time, I want to quickly go into the panelists for today. On our agenda, we can see a list of organizations. However, in those organizations, there are eminent personalities who I'll be introducing. So without wasting our time, the first person I will introduce is from the World Health Organization. The Technical Officer for Nutrition and Food Safety, Dr. Pinda Wakawa. You are welcome, sir. Thank you so much. Please clap for our panelists. Thank you. The next person I'll be inviting is the Director, Health and Social Care from the National Orientation Agency, Dr. Ayola Abiodun Olufemi. You are welcome, sir. Thank you so much. The third person will be Professor D.K. Oji from the University of Abuja. He is the lead investigator. The team advisor, Mr. Batet Musa. You are welcome. Please come. Where are you? Thank you so much. Please clap for our panelists. And of course, if I don't call my director, I'll be jailed here. Not just sanctioned, not just queried, but I'll be jailed. So I'll call my director, the National Coordinator for Food Safety and Quality Program in the Federal Ministry of Health and Social Bemiga John. Please put your hands together for him as he steps on the podium. Thank you so much, sir. And the last but not the least, I will invite from the National Agency for Food and Drug Administration and Control, Mrs. Omokari Boboy. Thank you so much for coming. She's the Deputy Director, Food Safety and Applied Nutrition. Thank you so much, ma'am, for joining us. Please let's set their mics to ensure that we get the best out of them. Thank you. So just to let us know, from the onset, I'll be giving them 2 to 3 minutes to make a subject area on what they do and what they do concerning sodium reduction in Nigeria. So setting the ball rolling, I'll start with Dr. Pinda to give us something on setting and implementing national sodium targets. So we expect you to say just 2 to 3 minutes on that. So your floor is open to you, sir.
Okay. Am I audible?
Yes, you're audible.
All right. Thank you very much, Femi. I would like to start by once again congratulating the Federal Minister of Health and other stakeholders for this milestone achievement that we are celebrating today. And on this setting and implementation of national sodium targets, where WHO globally, we are custodians of guidelines and policies based on evidence-based best practices that have been tested and run across different countries. And over the years, there have been different studies and in-country implementation of some strategies that have been done, and it has been proven to show some effect. Like in the UK, they set national targets and standards, and during the reformulation, they were able to achieve some sodium reduction over a number of years. So for WHO, in 2018, during a high-level meeting with different member countries, and at the Chatham House in UK in June 2018, came up with an idea, okay, why not, based on the success stories we've seen from the different countries, how do we come up with global benchmark that will guide countries in the implementation to achieve that reduction in the consumption of, percentage reduction in consumption of sodium. So there are 2 things that came out as outcome of that meeting. First, issue on reformulation of food by the industries. Then the second thing that came up after that during meeting is sodium labeling. These are all based on best practices. So narrowed down to how do countries adapt to that. In 2021, we launched the first global benchmark where we were able to categorize the different foods. And in 2024, we came up with the update of that benchmark. So for the countries, there are laid down steps that can be followed to achieve that. The first is having an empirical foundation. And for this, for Nigeria, we have local data led by Professor Oji's team, University of Abuja. They had that research, and that gave us a reliable evidence base that we can always make reference to. Then second thing in the process, key important thing is stakeholder engagement. It's a multi-pronged approach. From the beginning, you have to bring all relevant stakeholders to be carried along, and in the process, in one of the opening statements of FEMI, I like that one, said, in the beginning, there were some that we thought it's not achievable, but then they were able to win everybody on the same board. And because of what? Reference to the empirical evidence that we have on ground, local one. Then cultural relevance, you have to, although there's in the global benchmark, the food categorization is there, but in the context of Nigeria or other countries, what are those foods that are commonly consumed? How do you categorize those ones? So these are key things. And the last one is transparency and open communication at all levels. Whatever decision you're taking, let it be transparent and let there be that open communication. And all the stakeholders involved were regularly updated on the different steps, and all concerns that were raised were addressed. So for countries, these are, if you follow those steps, you'll be able to achieve, to be able to come up with a standard for the sodium targeting. Yeah.
Thank you so much for that brief opening remark. So I'll push ahead to the next panelists from the National Orientation Agency on designing effective awareness and education campaign. We saw that the minister unveiled the campaign tagline today. So we want to see how does it work out? How do we intend to do, or what's the best practice in that area?
Thank you very much. Good afternoon. I bring greetings from the National Orientation Agency. We love to be part of this. We are part of the design. This guideline participated, and we are so happy, and we are congratulating the Federal Ministry of Health and all the stakeholders are here for this. All these efforts, if it does not turn to behavioral change by the people that it's set to be, is going to be effort. Okay, it's going to be effortless. So we need to ensure community participation. People must be aware what we're trying to do for us to be able to achieve the noble goal of what this guideline was designed for. At the National Orientation Agency, our mandate is to ensure that government programs and policies are being disseminated to Nigerians in all the, in every part of Nigeria, of your tribe, your ethnic group, your age, and that is the way our office is being designed. And we are opening this platform to ensure that we carry this message because it's very important to us. For you all to be able to achieve the successful determination of this guideline, we need to know the population concerned. Who are the people are we addressing this to? Is it all Nigeria? We need to stratify the old people. We need to know this. And most importantly, we need to ensure that we have their perception, the perception of people that you design important. As we are seated here, our perception is positive towards this because we know the implications. But the people at the community, do they see it as a problem that they are consuming high salt, some cultures? So for you to be able to design effective communication, to change this their mindset, you need to factor this to our communication strategy. So we are going to deploy effective strategic communication with clear, concise, and consistent messaging, addressing specific target audience, with multiple channels. We require all channels, all stakeholders must be involved within the timeline for us to be able to achieve this. Thank you.
Thank you so much. I like what you said, consistent messaging. That is very key as well. So it's not just messaging for today, but for a lifetime. So I'll quickly move on to the University of Abuja, Professor D.K. Oji. Tell us about your role in research, the role of research in evaluating sodium reduction initiatives.
Thank you very much. I want to join other panelists by congratulating the Federal Ministry of Health and all the stakeholders who are in making this a reality. And I also want to appreciate the management of University of Abuja for giving us the right environment to carry out our study. So what is the role of research in developing a guideline? For researchers, one of the things that will gladden your mind is for your data to drive policies. It's very interesting. And every research that does not drive policy or lead to change in clinical practice is not impactful. Most times now we tend to judge impact of research sometimes on the type of journal you publish in. You know, maybe you publish in New England Journal of Medicine, JAMA, British Medical Journal, and that. But there's a shift, paradigm shift. How much does it affect practice and affect policy? So for we as researchers, what is our role, especially as regards sodium policy, is to be able to carry out very holistic research, evidence-based, that can stand the test of time, and that will be proud of, that you can present anywhere. So that is the hallmark of a researcher. So in this study, what we have stakeholders, that is the Nigerian sodium study, engage different stakeholders, both at the community level, the state level, the federal level. And when I say stakeholder, different people from manufacturers to policy people to healthcare workers, that is one angle. Because we wanted the knowledge, attitude, and practice around sodium. Do they even believe that sodium reduction can work in Nigeria? What of the conflicting issues of taste and so on and so forth? Secondly, we did what we call a retail survey. We went to the stores to, one, capture food that are already prepackaged. And when we say pictures of their barcodes and front of pack labeling, and also on packaged food. And part of what we have done as part of our retail service, even to go to the streets, whereby we're able to use some salt meter to analyze the amount of salt that are in food by food vendors. And we send part of those samples to International Institute for Tropical Agriculture in Ibadan, so that they can also do a lab analysis of 10% of what we did with our salt meter. Then thirdly, what we did was to get into the population. So we merged with the what's it called now? The last survey, a STEP survey. So we work with them in 3 states, in the north, in Kano, in FCT, that is central now, and then in the south in Ogun State. And what we did was to get to the population, ask key questions, aligning with STEP survey. Then apart from that, we collected 24-hour urinary sample estimation. And that is the best way you can estimate sodium intake in any population. And when you add to 24-hour directory recall, it strengthens it so well. And those are part of what we did. And at the end, we have come up with some data, which I'm free to share here. Because we found out that on the average Nigerians consume about 3.8 grams, of sodium per day, which is about twice what is recommended
by WHO. I also found out that most of the salt we consume comes from discretionary salt. That way, one thing also we found out from our study. So in general, what we have done is to present robust data, holistic data that can stand the test of time, and that is just an initial data. Maybe the second part, when I'm given an opportunity again, I will tell you that this is just the first set of data we are collecting. So this study is going to continue because we are going to look at progress that has been made over time. And the only way you can do that is to collect longitudinal data, even within the same population. So thank you very much.
Thank you very much, sir. I believe from what he has said, you understand that the data used in the development of this guideline is not only data on packaged foods alone, but goes down to the human level. Looking at even discretionary use of salts, aside from those already prepackaged for you in the market. So thank you so much for that, sir. I'll go to Ms. telling us something about partnership. How do we build strong partnership for sodium reduction initiatives? You have 2 minutes, sir.
Thank you very much. So I will try to utilize the 2 minutes. So two words I'm going to start with. One you've mentioned already, which is partnership, and collaboration. So these 2 words are critical to this initiative, to what it is that we aim to achieve. So a typical example is this room where we are. Seated in this room are people from different sectors, different environments, different backgrounds, knowledge-wise. But then somehow, we are all gathered in this room for one primary purpose. There's a reason why we're here, and that is to support this process of reducing population sodium intake, starting with the launch of this guideline. We even had the media who are here. So one of the first role they're also going to play is to also bring a report or send out a report of what happened. And that's the first step, right? And so overall for me, as an opening statement, is that partnership is key, collaboration is key. This is an initiative for the Federal Ministry of Health, but then we have different stakeholders who are involved in this. And that means we, or the government of Nigeria, can't do this alone. It will involve, it's going to require the cooperation, it's going to require the input of each and everyone in this room, and even those outside this room. Because at the end of the day, this conversation has started, and I want to believe that it is going to see to the end of it. Thank you very much.
Thank you, sir, for that beautiful opening. We talked about partnership, collaboration, and very important to us on this alone. Something he has not mentioned as well. There's a National Technical Working Group on sodium reduction, and the members are all in this room. So I think they've also been part of that collaboration to develop, and I know that they were also part of it. They were also part of the technical working group. So I think it's something that we need to applaud. And I think we've not given them the opportunity to stand up for recognition. So those that did the Jackie work here. So I think maybe without breaking protocol, I want the technical working group members to please stand up for recognition, and so that we can clap for you, because they did the Jackie work here. Please stand up wherever you are, please. Bro. Let's clap for them, please. Thank you so much for the good work you've done. We appreciate that work. And also by our consultant, our able daddy, Dr. Omotola Davis. Thank you so much for leading that effort as well. Thank you so much. We appreciate it. Let's have our seats, please. To do, so that we will not be crucified at the end of the day. So thank you so much for clapping for them and honoring them. So I'll go directly to my director now, Mr. Atonda John, to give us a role of subnational institutions, because we have some subnational bodies here as well. this is a national document. It's not just going to be in Abuja and being implemented in Abuja, but also let's see how we can look at the subnational bodies, where they come into play in this whole exercise. So, sir, the floor is open to you, sir.
Thank you very much. Let me appreciate every one of us that have been part of this system right from the onset. As we said, it was developed using the hallmark of partnership and the collaboration. And today, we are celebrating this landmark achievement. So which means it's a clarion call for us to increase the collaboration. And then at every strata of governance, at the federal, the state, and the local government. When you realize that most of some of the benchmark you have in the things have to do with the elites. It's the elites that usually go to buy food in the restaurants. To buy food in the hotel, the restaurants, and then some of these packaged food. But what of the local or the informal sector at the home level, where they're doing conducting parties and all those kind of things? So which means that the governments, the state governments, the local government, and then even the civil society organizations have a lot of things to do, because we know most of the time you operate at the local level. So we need that awareness. Is very, very critical. So though we have some structure on the local government at the state level, we have National Food Safety Management Committee, which we have to use as one of the platform that when it's strengthened, they will be able to establish it's part of the package of the document, in the document for awareness and sensitization. So we need to involve everybody. The state governments have their decision. Most of our NGOs, they operate at the state level, they're at the community level. So we need to try as much as possible to drive down to the grassroots the essence of this initiative. So even at the church, in the church, like I used to say, I tell people the other time, we started this thing. By the grace of God, I'm a minister of God, and I've established what we call healthy food program, my church. Recently, about 3 of the elders have a stroke. Who are the people that are very agile and routine? I just came one day testimony. I said, okay, this one, will I call it? No, they are good testimony because they didn't die. But so we now realize that which means that we have to use every means at the local level, at the church, at the community level, to sensitize people about the provision of this document, so that we'll be able to save the unsuspecting populace. Let me put it, because there are people that are not aware of some of these things. I'm surprised. Somebody even said because God saved him that he didn't die of. He didn't know he's educated. You know you are educated. It doesn't mean that you know about this issue. Yesterday, they just delivered some documents, some BP measurement, or 6, I think 6, to me on last Sunday. That we have to even use to do this thing for everybody on Sunday, or do church program, to let you know how critical this thing is. So we have to drive the message down to the grassroots, and then the understanding, the awareness to the grassroots. Thank you very much.
Thank you so much, sir, for that. So it's very clear from what he has said that, we need to, our subnational bodies need to, wake up to how they can support this at subnational levels, at all different types of levels, even informal levels, through our community leaders, religious institutions, and all that, to ensure that this whole salt reduction initiative is implemented fully at all levels. Thank you so much, sir. So quickly, I'll go on to Mrs. Boboy from NAFDAC to tell us about designing effective regulations. That's their main area. That's what they do. They are bread and butter. they make regulations and put the gavel on the table, and we must all obey. So how do we make such regulations effective and make them implementable, especially for this sodium benchmark? Thank you, ma'am.
Yes, thank you so much, Mr. Femi. On behalf of the agency, and especially my director, Ms. Eva Edwards, who is initially supposed to be on this panel, but she has to go to do some other pressing national assignments outside the country. So she asked me to represent her. NAFDAC, as a regulatory body, is mandated to regulate the manufacture, distribution, sale, use of regulated products, including food. And NAFDAC has been a key partner in this process of the strategy for reducing salt in Nigeria. University of Abuja's, headed by Professor Oji, had been partnering with NAFDAC in ensuring that the research is conducted very well. And we are also part of the National Technical Working Group on the strategy for sodium reduction. So as an output of that, the group recommendations, NAFDAC was instructed to come up with a regulation on how to guide the industry on reducing sodium or salt in their processed packaged foods. Because without us regulating that sector, the whole discussion may not bear any fruits that we want. So some processed packaged foods have been identified, over 30 of them, that is produced in Nigeria that has high sodium content. So in collaboration with relevant stakeholders, including the industry, we are advised to see how we can, we have already developed a benchmark to use the sodium content of these processed packaged foods. And how do we achieve the success of reducing that? Is by developing regulations to guide, to guide the industry on how they will reduce the quantity of salt in their processed packaged foods going forward, and also us, the regulators, ensuring that they comply with these standards. So as we received the instruction by the ministry to kickstart the process of developing regulations, because actually developing started the process, and the identified directorate in NAFDAC is the Food Safety and Applied Nutrition Directorate. So the director was directed to initiate the process. She came up with her internal committee, and a draft was developed internally. So the process of drafting regulations in NAFDAC is that after developing the initial draft, the draft will be shared with we have a regulatory affairs committee. They will look at the initial draft, study it, and then submit it to the DG NAFDAC, who will give permission for all meeting, including everybody, industry, anybody that is concerned, to come and look at the draft, agree, and then we take in all the inputs, and we post that regulation on our website for 60 days for the general public to make more inputs. So after that 60 days, we bring it down, and then look at inputs by the stakeholders. We update the regulations, and then present it to the DG, who will present it to our council. NAFDAC, by law, has a council that approves that we draft based on the needs. So the council look at the regulations and approves. So it's the approved regulation by the council that will be forwarded to the Honorable Minister of Health for onward submission to the Minister of Justice for gazetting. So the process has started, but it's still in the process. And we learned that the Minister of Health wants us to conclude by the end of the year, and we're working towards that by his grace. Thank you.
Thank you so much. It is not just launching of a document, but even the beginning of the implementation is currently ongoing.
Yes.
So I think you need to clap for the Ministry of Health, now WHO, Dr. Pinda, that, the federal government of Nigeria works with WHO as well to develop these benchmarks, this guideline that we have today. How was the partnership? What role did you play in that space? Over to you, sir.
Okay. Okay, thank you very much. So, for WHO, we saw much government-led coordination. And we're so excited when at the beginning of the initiative, when we approached for that. And we really enjoyed the partnership across the different sectors. That is from the development partners. We work closely at country, regional, and global level, and other key partners. Then within the country also, we want to appreciate because I made mention of some guiding principles in setting of national targets and adapting global benchmark, use of empirical database. And we Southern Study Group also gave WHO access to the database to promote transparency, and also in the analysis of the data. And during one of the consultative meetings, I remember also when some industry and other people were asking some questions pertaining the categorization of the food, we were able to access the database with even the pictorial samples for some of the foods that have been used. So for us, the partnership under the different principles from the beginning of the initiative, we have been members of the technical working group. And all communication throughout the process has been open. And our consultant at the global level also work closely with the national consultant. And there has been also series, aside the TWG meeting, there has been some bilateral meeting with different partners to see the different country experiences and the anticipated bottlenecks. And we're able to come up with recommendations that will help us to surmount some of these challenges that may arise during the process. So I think, in a nutshell, we really enjoy the partnership, and it's well coordinated throughout the process, government-led coordination.
Thank you so much, Dr. We know that the ministry and the government of Nigeria didn't just work on their own, but validated this work through the WHO, who is our global body on health. So we know that this document will stand the test of time, even globally, and it's going to be a document for not only Nigeria, but for even regional countries within the region as well. That NAFDAC already started the implementation process on their own end, within their own mandates. But we wanted to also look at what are those implementation that we can do. Sir, you heard the minister launch the tagline today, and we talked about implementing effective messagings and strategies. Tell us more. I know the first, we gave you 2 minutes or 3 minutes. Get audience with sodium reduction messages. So I know you mentioned about consistent messaging. Maybe we want to hear more about some of those things that you mentioned. Thank you, sir. Go ahead.
Okay, thank you. We need to ensure that we fund this process. We assume in quotes that communication is free. Communication is not free. If we want to achieve results, all stakeholders must be ready to fund this process. Everything you need for communication, both direct and indirect communication, you need tools and you need to fund it. That's the first thing we must ensure that we put on table and we are ready for us to be able to achieve our goals. Number 2 is the stakeholder involvement. We should strategize all our stakeholders from the community level and upward. At the community, we have a World Development Committee. These are people in the community that meet regularly. It might not be as functional in some local government, but it is in some local government that comprises of people in that community that lives among themselves, and they are able to identify their influencers religious leaders, community leaders, people that can talk to them for change. Because it is important as you are planning communication, your communication objective must be designed and it must be changing as time goes on. What do I mean by this? Now we want to create awareness. Everybody should know about the need for us to reduce salt. Yes, that is the first step. We want to create awareness. Information, it can be provided using different channels, a billboard, radio jingles, and all this. But that will not transform to the behavioral change that you are looking for if you don't follow it up by how to persuade the community. Are you getting me? Or demonstrate what you mean, either by book. It is not a devil's work. It is not spiritual. It is because his blood pressure has been rising for consistently uncontrolled. And what is causing it is because of salt intake you are taking. So you need to take practical step, practical demonstration. And that is why your communication objectives must be you must be changing it and provide materials and tools as needed. Also at the state level, you need to identify the food handlers. These are people, majority of us, especially the elite, we eat out. You need to have a way of communicating with them. The food processors that manufacture our canned foods and all those things, we need to engage them. Prof also said from the beginning of their whatever, they made some effort. Now that you have been able to come up with your research, we need to go back to let them see use your data to be able to policy maker. Federal government, Federal Ministry of Health has taken the lead, so they should continue. They should not get tired, and we ensure that this is consistent. Number 3 is that we need to use multiple channels of communication. Multiple channels of either direct communication or indirect communication. As a matter of fact, direct communication will be so helpful in this community engagement, citizen engagement, town hall meetings, because these people have been used to certain practices over years. So for you to be able to change their belief, their perception, you need to create a platform where they can ask questions regularly. It is not just putting a billboard or newspaper advice or radio program. Create a direct communication with people and give them opportunity to ask questions, demonstrations, and that was why I started that. If we are really serious to achieve results, we need to fund this process. Thank you.
Thank you, sir. Please clap for him. He did very well. I think you will understand from what he has said that he's a real communications expert. He has, he said something that stuck with him. When we mention influencer nowadays, we think he's on Twitter and Facebook and all that. But he mentioned community influencers and that we need to go to the grassroots, do town hall meetings, identify those community influencers, which is very key. Thank you so much, sir, for that. So he also mentioned the law. Because when you talk about town halls at ward levels, at all that level, I don't know if the Federal Ministry of Health will be able to go through that whole space, on their own. So how do you see state ministries of health, the state government, etc., subnational government, local governments, and all that, doing at that grassroots level? Over to you, sir.
Thank you very much. Well, I'm happy that we have the National Orientation Agency here, and I followed some of the procedures and then the actions that need to be taken. Just like I said before, the subnational needs to be properly activated, and then we need to structure. There's some structures on ground, which even I may not have even been aware. With the one way I'll be using at the state level, we need to go to the grassroots level as well. The local government level. So the state